Questions for your doctor. Below are some commonly asked questions that cancer doctors get from their patients who are finishing treatment. Read below to see the answer from a cancer doctor. Question: what medical concerns do patients have right after treatment ends? Answer: typically, there is a surge in anxiety and worry over the possibility that the cancer will return once active treatment is completed. Often, patients feel they are not doing enough to actively fight the cancer. Another common problem is that some physical and psychological changes don't disappear with the last treatment and seem to last for months or years after treatment ends. A few examples of such symptoms are fatigue, lack of stamina, difficulty focusing, changes in skin texture, or neuropathic nerve changes in fingers and toes. Patients often want to know what signs to look for to detect a cancer recurrence or return as early as possible. Question: what are some of the emotional concerns patients have once treatment ends? Answer: these include worries about cancer recurrence, one's identity and future, and dying young or leaving things undone. Some patients may also suffer from poor body image or low self-esteem because of the treatments they received. They often need help to learn to accept their new body, and that is perfectly normal. Question: how can patients cope with these concerns? Answer: we know that worrying alone feels awful and makes the sense of distress experienced by many patients and survivors worse. Being able to understand one's fears and to talk about them is a good starting point for effectively coping. Ultimately, a patient's inner strength and resilience allows her to endure this experience, sort through available options, and define a path or journey through the difficulties that lie ahead. Effective coping requires the ability to understand the situation, think through alternatives, ask for and experience the support of others, and feel comfortable with the chosen course of action or treatment. Question: how does a cancer diagnosis affect a person's family, friends, and caregivers? Answer: cancer affects not just the individual undergoing treatment, but the entire family unit. Spouses, children, parents, and friends often suffering along with the patient and may need information about the transition to survivorship and assistance coping with their emotions.